Hello, friends and members of the Massachusetts Medical Society. I hope your summer has been enjoyable and restful. I'm speaking with you today to provide both an update and a very important ask. Congress is currently on its August recess, and members are working in their districts, which provides an opportune time to share with our federal elected leaders the voices of our patients and our profession on three critical healthcare issues that Congress will be addressing when they meet for fall session: preventing firearm violence, increasing access to affordable drugs, and ending surprise bills. First, we recognize the leadership role the Massachusetts Congressional delegation has taken towards stopping firearm violence, especially in support of legislation that aims to close loopholes in background checks and to allow federal research into the causes of firearm violence. Secondly, our congressional delegation has also been supportive of actions to address the cost of prescription drugs. The high cost of prescription drugs hurts our patients and, in fact, puts their lives and health at risk. We must remain vigilant and consistent in sharing our patients' stories on the effects of high prescription drug prices, so that there's perspective around legislation that will require transparency and will allow Medicare to negotiate drug prices. Finally, understanding and navigating the healthcare system is more challenging for patients today than in any time in history, and surprise billing to patients only compounds frustration and stress. The Massachusetts Medical Society supports legislative efforts aimed at holding patients harmless, requiring transparency, demanding network adequacy, and insisting that the information on care and coverage is easily accessible and easy to understand. Specifically, we stand in support of federal legislation which gleans from the New York State model, which has proven effective in mitigating issues on surprise billing. In this model, patients are released from paying surprise medical bills arising from emergency care or arose from care which they believed was in network. The law also compels providers and insurers to determine reimbursement by way of an efficient and inexpensive appeals process that, among other factors, uses a percentage of local charges from an independent, verified database to determine a fair resolution. A recent analysis of claims data found that the New York law resulted in a significant drop in out-of-network billing and has positively impacted healthcare spending in New York, where the rate of growth of health premiums is significantly less than the national average. The data are encouraging, the results are measurable and favorable. Most importantly, patients are receiving dramatically fewer surprise bills, and physicians and insurers are incentivized to negotiate. So what is your call to action? I'm asking you to please contact your congressional representatives, whether through an email, letter, or town hall meeting. Tell them, as a physician and a member of the Massachusetts Medical Society, that you are committed to working with them to pass a federal law this year that will reduce firearm violence. Tell them we are committed to passing a federal law this year that will reduce the price of prescription drugs and improve access to life-saving medications for all our patients. And finally, let them know we are committed to working with them to find a solution to the surprise billing issue that resolves the problem for patients and which restores balance to the system so that insurers will negotiate on equal terms with physicians to improve access to in-network care. This is the time to meaningfully address gun violence, make prescription drugs affordable, and stop surprise billing. Thank you for your help to get this done. For more information on any of these issues and how to contact your Massachusetts senators and congresspersons, go to www.massmed.org/2019 federal. Thank you.